very, very glad to have young African leaders here today with me who want to share their information, who want to share how the situation in Africa is due to this pandemic. And I hope that we will hear from all of them what challenges they face and what we might be able to do to help them. I welcome Zachuas Ogonji, Eunice, Dennis, Chris, Dorcas, and I'm very, very happy to have you here.
Thank you.
And I ask you to introduce yourself, and maybe Zachuas, you can start.
Okay, thank you. I'm very glad to be back and to see all my friends with me today. I think this is my third time on the show, and I really thank you for your kindness, for always wanting to give us a platform to share about what is happening in Africa. We do not take it for granted. And as we share about today the issues, I know you'll be hearing so many voices from us, and some of the things will go a long way in helping us reach solutions. So I am Zachuas Ogonji, as you have said. I'm a founder of Inua Village to Global Foundation, an organization that works with children in Kenya. We run community schools, we run community programs that help families get better and address challenges that they face on a daily basis. I also work with Lift the Children, and I work across different children homes. So I'm very glad to be here, and I hope to have an opportunity to share the perspectives around the COVID-19. Thank you.
Thank you.
Thank you. Who wants to go next?
I can go next.
Okay.
My name is Dennis Kithinji. I'm a founder of a business called MedRight Consulting. We basically do medical writing and healthcare writing. Something else I do, I am also a primary researcher, but at student level, I'm doing research on using herbal products to treat infectious diseases. And so I was glad to be part of this discussion because COVID-19 is basically an infectious disease. So I'll be glad to give perspectives about the microbiology of COVID-19 and also how it has affected us as Africans. Then I will also be glad to share about the challenges that our healthcare system faces in handling COVID-19. I will also be glad to respond to some of your questions in that perspective. Thank you.
Great, thank you.
Hello.
Hello.
Hello too.
Good to see all of you here. My name is Dorcas Wamaitha. I am a lawyer, corporate and tax lawyer, practicing in Kenya. I've been an advocate for the last 5 years, and I'm happy to be part of this discussion. And I look forward to an engaging time with all of you. Everyone has been affected by COVID, and it will be great to share our insights on how this pandemic has affected us as persons and the continent as a whole. So I'm happy to be here, and I look forward to engaging with all of you. Thank you.
I'm happy to have a lawyer here. Thank you for attending.
Thank you.
Who wants to go next?
Good afternoon, everyone from Kenya.
Good afternoon.
My name is Eunice Kavaya. I'm actually glad and happy for this opportunity to be here with this team and be able to learn from you on how COVID has affected us. I'm actually the founder and CEO of High Five Adventures. This is a tour company that specializes in safari, family safaris, individual and group safaris. Once again, it's an honor to be here and looking forward to learn from you.
Thank you.
Yeah, good morning. Good afternoon, everyone. Also happy to be here, just as everyone has said. It's really a great opportunity, of course, to connect on a Sunday and to have such a serious conversation on what is affecting us. My name is Chris Ouma. I consider myself a youth worker because I work mostly with young people.
Oh.
But in terms of training, I've trained as a medical researcher and public health specialist. And I focus so much on work relating to research to be able to understand dynamics, especially in the African continent. So I've worked in both West Africa, Central Africa, Southern Africa, and Eastern African region. So really a lot of perspective on issues around youth, reproductive health, and development. So also a pleasure to be here and look forward to a great conversation. Thank you.
Looking forward to. As we have two health medical experts here, I would like to hear about the way the pandemic has affected Africa and if it is really a pandemic over there. So who wants to answer, Dennis or Chris or both of you?
Let me go. That's a very interesting question. Is it really a pandemic in Africa? First of all, I mean, from a research perspective, looking at the numbers, what qualifies then to be a pandemic? Is it based on the numbers? Is it meant on the effect it has in the population that you're considering? Because Africa then form part of the global community, definitely it's a pandemic. Then we don't isolate apart and say because affecting part of a population or part of the world and the other part is not affected, so it's not a pandemic. The fact that it's affecting us globally truly is a pandemic. But what is interesting with regards to COVID, it's the very fact that Africa is not suffering a pandemic for the first time. Mm-hmm. I think we are already in the middle of a pandemic we call HIV. Mm-hmm. So this one also comes to add on to what Africa has been experiencing for the past number of decades. And also going by the numbers, I mean, globally, we are talking about over 100 million cases versus about 2.8 million cases in Africa. I mean, that's COVID. So truly, it's a pandemic in the continent, it's a pandemic globally, but then probably the disposition is what differs at the moment. And maybe later we talk about that, what that means. But I would say it's really a pandemic and it's affected different communities in great lengths. Thank you.
All right. Maybe to add on what my friend and the colleague sometimes at work, Chris has said, yes, COVID-19 is a pandemic. Why? Because it has affected the entire Africa and it's across the globe. That's what defines a pandemic. But then there is the other perspective of the extent to which it has affected Africa. At the beginning of the pandemic, the estimations were that we will be getting about 2 million cases. I mean, about 2.2 million deaths. Then right now, the deaths are about 60 deaths. That's estimations for Africa. And then something else, the infectivity and the fatality, or rather people who get disease from the infections, we can tell from the studies that have been done so far that they are not as severe as it was imagined at the start of the pandemic. Why? Because, for example, our research institute here in Kenya, KEMRI, has done some studies, and there are some also other studies, what we call seroprevalence studies that have been done in other parts of Africa, and they have shown that Africans are having those antibodies against the virus, but then most of them are not getting disease from the infection. So it means the virus is spreading to extents of about 20%, infecting about 20%, but now causing disease and leading to death in only a few of Africans. So the dynamics about that are a bit complex, but we are still continuing to understand. So just to start, that's what I would say.
Good.
Yes, this is what we are facing in many countries on the globe, that it is infectious, but it's not really deathly. It's not like Ebola or HIV. And still, during Ebola and HIV, high times, I say, we did not face those lockdown measurements. How is the lockdown in Kenya at the moment? What are your regulations?
Can I maybe share on that? I think across Africa, it has been very challenging to lock down completely, like what we have seen in Europe and other parts of the world. And basically, I think it's the reason as to why we are having this conversation, because on one hand, you really want to lock down. On the other hand, the consequences that comes with locking down are very, very severe than the disease itself. So African countries and governments have found themselves in a very tight spot. Do they lock down completely or do they not? So in Kenya, they have opted for, in the beginning, they opted for closing down parts that had high numbers of infections. For example, Nairobi was isolated, Mombasa was isolated, so people could not move in and out of those spaces. But then they had, that went on for a very short time because they could not lock them completely, because still Nairobi population depends on farmers from rural areas to bring in vegetable, bring in fruits, bring in different things. So they could not completely close it down. Even during that time when they said Nairobi was closed, they allowed cargo to move in and out of Nairobi and stopped. And then they went for night curfews. And this is, I think, what has been very severe for many of the businesses here, because many young people are in the entertainment industry. They depend on night shows. They depend on what happens in the clubbing industry. And we have seen the curfews have gone on since day one up to now. So it's still, it has crippled a lot of industries that depend on nights and evenings sessions. It has also affected normal people, because then even when I'm planning my field work, I can't travel overnight. I have to plan to travel during the day. So the lockdown, as much as it has not happened the way it is happening in Europe, what we see, even the little measures of locking down in a place like Kenya has really affected so many. So I wonder what will have happened if they went for a complete lockdown.
When is the time you need to be at home at night?
Latest is 10 p.m.
10
So from 10, yes, the curfew runs 10 p.m. to 4 a.m. in the morning.
Okay, this is not too bad. Okay,
yes.
What about the hotels and the bars and so on, and the restaurants? Are they closed or not?
Well, last year in August, the president opened up for international tourists, and after every 1 month, he's been coming up and readjusting the rules. So initially, the restaurants and the bars were completely, locked. No one was allowed to go out and eat or even mingle in the social areas.
Mm-hmm.
But now that has been lessened a bit. People can go out and eat. People can go to the bars and drink, but the same rules of lockdown applies. They are only allowed to operate within the stipulated time that's allocated in the lockdown.
Then can I add something?
Yeah.
Just adding on to what my colleagues have said, yeah? Let me start with what Dennis said. I think for Africa, we seem to have weathered through the pandemic. And I was reading an article that scientists are still puzzled at how Africa has weathered through this pandemic. Is it because of the antibodies that Dennis has mentioned relatively appeared to weather through the pandemic compared to other continents, yeah? Mm-hmm. Now, regarding the containment measures, let me talk for Kenya. It's very, very difficult to lock Kenya completely. Why? Remember, most of the population lives from hand to mouth. Mm-hmm. They live literally from hand to mouth. If you lock them completely, some of them will die of hunger. Let's go to social distancing. Think about social distancing. We have quite a number of slums, not just in Kenya, but in the African continent. These people who live in the slums, if you tell them to social distance, it's close to impossible. But somehow, somewhat, they have managed to weather through. The death toll compared to other nations has been quite low. So I would say, as far as the containment measures and the social distancing rules are concerned, we cannot be compared to other countries. Other countries have had drastic measures, to contain the virus. Africa has relatively performed well. That is all I wish to add.
Yes, from your point of view, the measurements and the infections, are they in equilibrium? Is it okay, or are the measurements too high for how the infection is?
Maybe.
Okay, sorry.
It's all right. You can go ahead. Should I?
Okay. I would say the measures that have been taken by the government as far as the pandemic is concerned, the containment measures, I wouldn't say they are very drastic. I would say they are commensurate to the rate of the rate of infection, because you'd imagine on an average day, I also get to the house by 8:30. So making it 10 p.m. is not that bad, unless for people who work at night. And we have this essential service provider. A good example is our profession. So there was a petition that was, taken to court last year to say that lawyers are essential service providers. There's a story I like to tell. So there was one particular evening, we were coming from our country and we got to the estate at around 10:04, just 4 minutes past the curfew. And the cop was quite mad, told us to come out of the car. You are so late, just 4 minutes. And I decided, let me not say I'm an essential service provider. Let me just play dumb. And he really harassed us, just 4 minutes past the curfew timeline. So when I realized he was taking us in circles and wasting our time, I just waved my essential services card provider. And he was like, "Madam, you'd have told me. Why didn't you say you're an advocate? I would have released you a long time ago." So for essential services provider, you are allowed to move around even past the curfew. But I would say, in my view, the containment measures, 4 p.m. to 4 a.m., 10 p.m. to 4 a.m. is not so bad. Because for an average person, that's the time you're normally in the house. And we live in the morning hours, we live at around 5, 6. So it's not as drastic as you'd imagine.
Okay. Do you have to wear a mask all the time?
Maybe to add on to what she said.
Someone else can answer that question.
I'm saying to add on what she said and to respond to your question. One, yes, we have the rules, and there's what we do. Practically, I live in a rural town, Maua town, and I can tell you that, yes, there are curfew hours, but people operate even at night. Secondly, there are rules to wear masks, but if you go to town, even right now, you will find that the odd ones out are the ones who have worn the masks. So, again, during the weekends, political rallies are fully packed. Something else, even in matatus are fully packed. The social distancing measures that were put in place are no longer being adhered to. Yes, in Nairobi City, sometimes they are adhered to, but once you get outside the city, things change. So what I would say is that the measures, yes, we could accredit them to what we've experienced in terms of low numbers, but essentially I would say what we've been having provides for the transmission of the virus. The measures really weren't operationalized as we would expect or as would be effective to contain the virus. Something else about the deaths, she mentioned about that. It was predicted that we would be having about 150,000 deaths, but right now we have about 60,000. Again, it was predicted that we would be having about 70 million cases, but we only have about 2 million cases. So yes, we are doing well as Africa, but now as she said, it's puzzling scientists because we don't really know what exactly is making us do well. One of the things that is predicted as helping us is our relatively young population. Only about I think about a very small percentage of our population is aged above 65 years, compared to, for example, Italy's population, in which more than 23% are aged above 64 years. But in our case, it's only about 4%, I think. So relatively young population. Again, in microbiology, there is what we call priming of the immune system. We've been having coronavirus, but not SARS-CoV-2, the one that is causing COVID-19. That coronavirus, since Africa is endemic to various infectious diseases, it's one of the infectious agents that has been around. So most of us were exposed to it, and it could have primed our immune system to prevent any other related infection. So yes, it was not SARS-CoV-2, but there is the human coronavirus that we've been having around, and therefore it could have prepared our immune system to help us fight related infections, amongst them which could be SARS-CoV-2, but it's just an hypothesis, not yet confirmed. So
yes, I think Dennis is alluding to something very important. And I also want to share on the question you asked, whether the measures taken could be contributing to the low numbers. I agree with Dennis that there's a mismatch there. There's what is written, there's what people are supposed to follow, but then there is the reality on the other side. But this reality is also a symptom of a far much bigger issue, a government that cannot be trusted. People are not trusting what the government is doing, because on one hand, government is insisting that you should wear a mask, you should keep social distance, you should be able to observe these and these rules. But then the same government, or some people in government, they are going on with their political rallies, they are going on with political events, and in some cases, they are captured on TV without masks themselves, while they are in a church function or whatever. So it becomes, the citizens think this is maybe something that is not very serious, because then what the leaders are saying in terms of rules vis-a-vis what they are doing in action are two different things. So I think when I look at what is happening, it points us to a place where government has pushed the citizens not to trust them fully on this COVID. And I dare to say that if it was real and if it was severe, then Africa will have suffered a very big blow, because then the behavior and the culture, the way we have been doing it, is something very different.
Wow, can I add something onto that?
Yeah.
You know, there's this joke that was trending a while back, that the government of Kenya thinks the pandemic is being transmitted in the dark. I mean, why have they imposed the curfew from 10 p.m. to 4 a.m.? So there was that joke. And you know, there was also this expose that was done a while back in Kenya on the COVID billionaires, how some politicians have cashed in on this pandemic. They have been, you know, when donations come, the allegations are that they have been embezzling these funds, you know, showing that the situation is very dire in Kenya. So as Zachuas is saying, the citizenry has been forced not to trust the government, and they are wondering, was the pandemic there in the first place, you know? So those are some of the questions that the citizenry is grappling with. And of course, I mean, we know it's there, but people are just, you know, peddling these rumors. Was it even there in the first place? Like, is the government trying to cash in on this pandemic? Yeah.
Let me come in and also give a perspective to a number of issues. Number one, I tend to think that because the very initial conversation about COVID started in Europe and in the West, and it took some time a bit before I would say, the discovery about the existence of the virus in the continent, there was, I would say, fear that then came within the population. especially what you are seeing on international mainstream media, CNN and BBC and the likes. And so by the time most of the African countries were working towards putting in place measures, I think the population had already gotten to a point of fear. And if you could see, the behavior, especially in the initial month, like for example, in Kenya, starting around March, early March, let me say early March, the behavior within the population was, for me, really surprising in the sense that people even flocked into the supermarkets, go and grab a lot of, because we didn't know exactly what we could expect as a population. And we could see fear within a population, people rushing, trying to stock food, trying to get themselves prepared on the uncertainty that would come with what we saw in the West. And that was really critical in terms of a response mechanism. Secondly, we had a lot of time for African governments and policymakers also to learn what was happening and pick and then try those protocols, as opposed to places like Europe, where this thing just happened. It was just like, a burst that was not expected. So it was like, we don't know, we don't have a script, a reference to then use to be able to put measures in place. So I think that played a key role in terms of how the African continent, with the gradual cases being reported, to be able to prepare enough. Secondly, as I said, Africa is not new to the conversation and the experiences of a pandemic. HIV has been here. HIV is big. I'm looking at the numbers. We have like 1.6 million cases annually in Africa. Those are not just small numbers to talk about. Ebola was here. We had different African governments sending even service providers who went through a thorough training by WHO and other really renowned institutions, and also worked towards creating a very strong community health system that is still in place. It's very functional. And so these are things that for me have worked to the advantage in terms of just the preparedness, in terms of the sensitization, in terms of helping to respond adequately to other crises, including now COVID. Now, about whether the measures in place compare to the numbers we are having, first of all, I tend to think as a researcher, the numbers we are posting as what could be a reflection of, or the picture in Africa, is inadequate, in the sense that not all governments have invested enough, for example, to be able to do enough testing the way it has been done in other jurisdictions across the world. So let's say, for example, in Kenya, we are talking about the numbers of 100,000 cases. How many people have been tested is hardly 1 million of a population of about 45 million. So if you look at that number, compared to testing that have been done in other jurisdictions, we could be still below in terms of the numbers. So that could be reason as to why we are still at 2.8 million cases across the continent. So that could play a reason in terms of the capacity to be able to test the population across. Secondly, is the aspect of how the structures functions. And I think Zach has alluded to this, what I call the social stratification. African communities, as they are and have always been, it's informal kind of interaction that takes place that then becomes very difficult then to apply formal protocol or structures to be able to control such. And let's say, for example, recently I was in my rural community, village there. And so there are these traditional events that are still taking place. They could be attracting less people because still the country is not open to larger gathering. But then within those social spaces, people tend to trust them and their friends because of familiarity rather than the scare of the disease. So how much information has been shared in our local communities and how much trust then we, because I see you smiling doesn't mean that then you don't have the virus. I see you walking around doesn't mean that you don't have the virus. So the way we interact in our communities in itself partly has played a bigger role, leave alone what the government has put in place, to be able also to help us one, respond effectively, or two, not do the right thing, because it should be understood that in Kenya, we have both national government and county government. Now, county government are devolved units. So they are closer to the larger population. And fortunately, again, those smaller units actually in charge of health, because health is a function that has been devolved in Kenyan, political structures. So that means there's a lot of interaction with community health systems that in itself could have played a role in terms of sensitizing. Well, the politics we hear seem to be happening at the national level. It has a backlash in terms of how the population respond, but that could really be restricted to a population that is connected, that is on social media, that is online. But a population, especially in the rural communities, they're still interacting with the community health workers, community health volunteers. So there's a lot of information sharing, a lot of measures that have been put in place, especially at the community level, rather than at national level. But again, as Zaka said, trust is an issue, especially on behavior in public health. Thank you.
This is very interesting to me, because in the end, it's all about trust. And what is happening here in Europe too is that the people don't trust the government and the measure and the regulations anymore. And I think that the issue of trust is only carried to the surface by the infection, by the pandemic. It has been there before, but now we look at it.
It's very true. And it's something interesting about Kenya again. Just before we got ourselves in the middle of the pandemic, there were a bit of reshuffle or realignment within the Ministry of Health. So we got a new cabinet secretary or a new minister coming in place who had a lot of inspiration in terms of how they communicated with public. And that played a positive role in us getting started into the COVID response. And then we also have a cabinet administrative secretary who has also inspired a number of people within the public spaces. So I think partly government got it almost right at the beginning, and a few within the population then got that inspiration to be able to respond adequately or effectively. Because you go to public spaces, and I think it's already becoming you abiding or following the rules seem to be now a socioeconomic fight. So there are people who are wearing masks, and if you're wearing this mask, okay, it's you people, corona, or the virus exists in your spaces. For us, the local people, the common man in the informal spaces, corona no longer exists. You go to our rural communities, and it's like, okay, you're coming from the city, maybe corona or the virus in the city, here in the village, life is normal. So I think there's also a socioeconomic issue that is interplaying, and we need a lot of inspiration really to be able to get everybody on board. Thank you.
Actually, thank you so much, Chris. I agree with what Chris is saying, the socioeconomic aspect, because what people are doing now, they are wearing the masks because they don't want to be arrested, not because there is COVID. That's where we've got to. I'm wearing this mask so that the cops don't arrest me and life moves on. Yeah.
It's the same here, Dorcas. It's absolutely the same here. People only wear the mask because they would have to pay penalty and would get arrested. That's the only thing.
There's also another aspect that happened. Africa started very early, closed down very early. In Kenya, for example, immediately the first case was recorded and reported in March. They went for the full-blown scale of measures. And as time went by the time we are reaching August, the population was already fatigued. Mm-hmm. All the messaging that the ministry had, the government preparation had put in place, had now become a song, that people could hear and ignore. I think the media played a very significant role in the beginning. They were very active. They raised a lot of awareness. People were very creative with the messaging so that it can reach everyone. There was a lot of, the walls were painted with the virus and a lot of good messages. But then as time went on into the September, into December, people were getting used to it. The media was now no longer giving it as the first headline of everything, and politics was starting to take center stage again. A lot of other mental issues started to come by, and I think this is really a subject that we can talk about today, the mental issues that came as a result of COVID and the lockdown. This became very real issues, so we ended up in a place where these are being reported more now than COVID. You know, so we have a mother who has murdered all the children, we have a father who has killed all the children, or a house, or someone else burned a house with people and all that. So that becomes what we started to see more and more. And even today, if you watch news in Kenya, probably the COVID issue will be given maybe at most 2 minutes of highlights. And it's no longer the big grand news that people are looking forward to. I remember in the beginning, I wouldn't want to miss the news for anything. I wanted to know how many have gotten, how many have died, how many were this. And then as this went on and on, it became normal. I no longer watch, follow news. Maybe I just read, this is the new infection rate, this is what is happening. And then I think government did something rather interesting. At the peak of it, they opened schools, they reopened schools. And immediately they reopened schools, the numbers have been very, very low. You know, like the infection rates, I don't know if it's something or it's just me reading too much into it. But then since the schools opened, the infection rate have gone below 5. And this is what they have reported since January when schools reopened. So is it an issue of conversation or something, a narrative being created and being driven? Because government was already getting a backlash for closing schools for too long. Parents were getting a little bit impatient with having the children at home all the time and throughout all that period. So I don't know where this comes in, because then the issue is things seem to be very controlled in a certain way. And this builds into the larger trust narrative that we are talking about.
Yes.
Actually,
So indeed, there's a lot of collateral damage. And Eunice, I just wanted to ask you, as you are in the traveling business, how has this collateral damage affected your business?
Actually, before I answer that, I just wanted to add a comment on what Zachuas has said. You know, I feel like politicians, they always make a situation to suit their, to suit what they want. As Zachuas was talking, I just thought, interestingly, 2023, and that is next year, we're going to have a general election. And as Dennis Kithinji, excuse me, was talking about nobody actually following, the COVID measures put in place to help us, curb this disease. I was just wondering, we have elections next year, and what we've been seeing on the news, it's more of not what we can do to help COVID-19 go down, but more of whom are we going to elect next year, what we need to do, as in it's just all the politicians for themselves. Yeah, we keep on seeing rallies all over, followers of certain politicians fighting over, that's really, for me, truly, that's really sad. And I, just like Zachuas, I feel like COVID-19 is now behind our backs. Children are back to school, the government feels like it has contained the disease, and now let's move on. Let's work on this election and see who will win. Talking about the COVID and how it has affected my industry, like I had mentioned earlier, they opened for international tourists in August. And actually last year, when COVID-19 was officially announced in Kenya, in my industry, there was confusion. I remember I had clients here already, international clients, and they were here, and the president had already spoken and said, we are locking down the country. And people were confused. My clients would call and, you know, they had more days to tour and do the safari. They were confused. They didn't know what to do. They wanted to come back and try and go out. Luckily, most embassies in our countries tried to evacuate their citizens. But what I can say that the pandemic, what it did, it brought the hotel industry into a drop, into a halt. People didn't know what to do. Hotels were closed, restaurants were closed, jobs were, you know, jobs were lost, and airlines shut down. And, you know, especially for me as a tour company, we rely on these suppliers to make our company work, or rather for us to progress. If we don't have the hotels, no airline, you know, we cannot provide any form of service. So for us, we felt like we've gone back to a startup. We are on a standstill and we don't know what to do. But as we have been going, we realize that COVID-19 has actually changed a lot of things, and we can no longer operate the way we used to operate before COVID-19. And so right now, what we are focusing more on is domestic travelers, because what COVID-19 has done is that it has made people uncomfortable. People are no longer comfortable to go out again. Even in Kenya locally, most people, they don't want to go out. They just want to stay at home and, you know, be together with their families. Those people who are taking COVID-19 seriously. So we are just, you know, finding ways to come out again and to encourage people to come out and work. We're also repackaging our packages to make it, you know, to help people see that, well, I can do this. I can, you know, I can still travel and be comfortable again and be safe. Yeah.
So even Kenya is going back to national tourism.
Yes, slowly by slowly.
It's in a lot of countries that they go back to national tourism. They don't have, most of the countries don't have the hotels and the restaurants open, but hope that they can reopen in summer. And countries that depend on tourism, such as Greece, are suffering tremendously in economics. We are facing a breakdown again, like in 2008.
True.
Speaking
I
about
went down to the bakery last week, and even the baker, he said, I don't know whether I'll be open next week.
Yeah, if I could just come in and comment, especially on the political aspect and probably the uncertainty around this. I'm a politician, so sometimes I defend positions, especially when I hear people say, "Oh, politicians are doing this and this is not happening." One thing that we must really acknowledge is the fact that the politics, especially in the African continent, probably different from politics in the rest of the world. Let's say, for example, we have had the US going into election in the middle of a pandemic, and it was really one of the deciding factors when it really came to the political campaigns. If you look across the continent, several countries have had elections since the pandemic. We've had, for example, a neighboring country, Uganda, just had election the other day. We had Malawi going to elections and several other countries. But interestingly, what is unique about Africa is the very fact that COVID or the pandemic, as much as it's there, it never formed really a manifesto or political conversation during campaign, which is something that should be unique in terms of how then we play our politics and how then we apportion even blames when it comes now to respond to this situation that we find ourselves in. The very fact that Kenya is going into election in less than 18 months next year, and we are still in the middle of a pandemic that has already wrecked in terms of economic, social, I would not say political, a situation of the country, and the attention the politician then pay to this. One, I would say, let's not make an assumption that it seems we have forgotten so much that the pandemic was here. It's still affecting us. The Ministry of Health in the country is working round the clock. There are a lot of things that are happening. If you go to our public health facilities, if you go to most of the spaces, the protocols are still adhered to. And as I said earlier on, we might not see adherence to the measures, especially in the informal spaces, because social interaction within the African spaces, our communities, the way they are, at point, it just becomes cumbersome. It becomes an inconvenience. You go, for example, to what Kithinji was calling matatus, public transport system. And these guys are saying, because of the economic situation, the fuel prices in this country have gone up. The Ministry of Transport is telling guys, you need to restrict and still have less passengers within your vehicle. And they're saying, look, the same government has increased the fuel, the pump prices have gone up since January, since December last year. The pump has gone up. And then you're telling me I carry half of the passengers I used to carry. If I increase the cost, these passengers are crying, you know what? I'm still jobless because I lost my job because of the pandemic. Government wants more taxes. You want me to carry less. How do I then top up or compensate for the loss that is likely to come? So those are the dynamic I'm calling the social interaction and the challenges that make African spaces very unique from other spaces. So what happens then? Government is in a fix in terms of a compromise then that you can do to be able to get parts of critical parts of the economy functional. Let's say, for example, get children back to school. The ministry and the authorities had actually done their assessment and a lot of audits to be able to make sure that, quote unquote, there is safety to an extent that we can allow children back to school. Because the more children stayed at home, this is an experience. Many parents will tell you, oh, you know, I'm spending a lot on food, and now it's becoming a social menace. We can't handle these children. There are a lot of issues. So government then to ease them, or just to press a little bit pressure go down, allow these children to go to school. Then the pressure in government goes down, okay? Then you're saying, okay, the schools have reopened. Zachuas knows this very well. We are taking these children back to school with almost zero investment in terms of expansion of infrastructure, because then even seating arrangement has to change. A classroom or structure that used to accommodate, let's say 40 students or 40 people can no longer, because of the new measures, you need to have like half of that sit inside a classroom to maintain social distance. And then half of them probably learn under a tree. So there's a dynamic in that. Then you ask the same government, now you've told them to go back to school. Have you done adequate investment or probably preparation in terms of creating more spaces? Now, technically speaking, how long will it take us to put up structures to be able to accommodate these kids? Politically speaking, we say, as a government, you had all the time from the time COVID happened. The imagination of government by then was that as this is happening, if we can contain this situation, life will come back to normal. So there are a lot of political conversation that then throws people like us who have interest in policy conversation into a disarray. But anyway, all said, I would say that especially most of African government, with the exception of Tanzania, because we don't know what's going on, most of African government has done superbly well in terms of managing the situation, because one, we have increased investment in health sector, and Dennis will tell you this. Most of hospitals before COVID, very few really had capacity to be able to handle crises, especially the ICU. Number of beds have increased. So a lot of things have happened, a lot of procurement, even in terms of human resource development, a lot of investment in terms of infrastructure. So I would say our governments have fairly done well. Unfortunately, we have not been able to manage how we relay this information, which is critical then to a better response, how we engage. Because for example, HIV, we would not say HIV, we did well because of the investment we put in place, but the communication. When HIV was just really in the early 90s, we would get, for example, all the stakeholders we would get the imams or the heads of the religious institution come out and speak about this. We would get teachers talk about this. We would get key stakeholders.
Oh, your mic is muted, Chris.
Can you hear me?
Yes, now we can hear.
I was saying that we had actually a multi-pronged approach to how HIV response was. And all the leaders from across, whether we talk about religious, we talk about political leaders, economic, and all spaces, people talked about this. Unfortunately, today, the blame has been apportioned, especially in the political leadership, to speak about COVID. And we have seen, let's say, for example, we had churches or worship places also put measures and restrict going to. What has happened today? They are hosting politicians in their spaces to have a conversation and also to make money from those spaces. Businesses want to open because businesses also have to raise a voice and say, we will scale down, we will be able to put measures so that then we reduce in terms of the traffic within our spaces. So it's a holistic approach. Unfortunately, because of the way government has communicated, we've had a bit of resistance, so to speak, because they are campaigning, their business, let's also open and get back to our business. So that's a dilemma that we find ourselves in today. Thank you.
Wow.
Thank you.
Let me say something. I like how Chris is breaking it down, yeah? Indeed, the government has fared well. You know, when you think about when the pandemic first hit, I know there was some, because this is very close to my heart, there was some fiscal or tax interventions that the government put in place. I mean, we all witnessed that in terms of taxes, people who are earning, who are in the lower tax band, they were not paying any taxes at the time. We also saw companies paying a tax rate of 25% instead of 30%. You know, the highest pay as you earn, that is tax on employment income. It was 25% as opposed to 30%. We also saw them reducing the rate of VAT from 16% to 14%. So, I mean, there were numerous tax interventions last year, and all this was supposed to ameliorate Kenya. From a perspective, the government really tried. I think last year we experienced two tax statutes. That is the Tax Laws Amendment Act 2020. That was the first act. And then there was the Tax Laws Amendment 2020, the second act. But no, there was also the Finance Act 2020. Actually, there were three. So the Tax Laws Amendment 2020, the second act, it came to kind of reverse the benefits of the lower tax rates. It came to kind of bring back the 30% rate, to bring back the 16% VAT rate, you know, to bring back, you know, the various tax rates for pay as you earn. So people are here left wondering, does it mean that the government says that COVID is now behind us? Is there a sense of normalcy that has returned? So those are some of the questions that, you know, linger in the minds of Kenyans. But be that as it may, we have also witnessed that anyone earning 24,000 and below, even today, they're still not paying any tax. The government has actually really tried to cushion, you know, Kenyans from the effects of COVID-19. But as Chris is saying, I think how they communicate sometimes doesn't really get to us as Kenyans. The communication, there is maybe a communication breakdown between how these politicians communicate to us on how they have intervened to make our lives better.
Maybe to come in,
go on, Dennis.
I'll first make a comment regarding the situation that Marianne described about Europe. I think despite our challenges as Africans, what I'm observing is that humans are responding to these measures, to the COVID-19 the same way. Because she has said that people are wearing masks there only because they are fearing police and such other comments. Perhaps this is based on how human psychology works. When you're presented with the problem, first of all, you react out of fear and therefore you put in measures, but as the problem persists, you learn to live with it. So maybe humans, including our governments, have learned to live with COVID, but this is scary. Why? Because if we look back at the plague in the 1600s and how it was spreading across Europe, that human psychology is what facilitated its killing of many people. Why? Because people would become, accustomed to the preventive measures, and therefore the plague would spread even more and kill even more people until they were shocked by the number of deaths, and therefore decided to take very abstract measures such as burning of houses so that all the rats that were there would die. So yes, in COVID, we might be spared because it's not as severe as the plague, but we are at risk of other infectious diseases. If they come and we go into it with the same psychology, it might affect us adversely. Coming back to Africa, Chris commented about the limited testing capacity. And I would say, yes, our number of cases are low because we are testing less. At the beginning, we were even testing people who would come to the facilities randomly. But right now, even if you go there and request for a test, unless you're paying for it, it's unlikely that you will get it, even if you have the symptoms. Unless the clinician highly suspects that this is COVID, that's when they are likely to request for a test. So the numbers we are getting right away are numbers that are visiting the hospitals, and the clinicians have highly suspected that it's COVID. Added to that are the numbers of people who are traveling, and therefore they require the COVID-19 certificates. So the numbers we have are not the picture of the transmission of the disease. And that's why the seroprevalence studies being done on donated blood, and on dead bodies, that's on post-mortem samples, they are showing that the prevalence across Africa is between 6 and 40%. Like in Kenya, it's about 20%. And even in Zambia, a study done recently in Zambia on dead bodies showed that. So it shows that most people are getting the disease, but they are not knowing because they were never tested before. They either recovered or they died. But then even amongst the dead, the main causes of death are not actually COVID. You will find, as Chris mentioned, our pandemics that we've gotten used to, HIV, tuberculosis, are the main causes of death even amongst those people who test positive for COVID-19. Something else, I'll talk about our vulnerability in Africa. We are vulnerable to infectious diseases. Why? Because out of the 25 countries that are considered very vulnerable to infectious diseases, 22 are actually in Africa. Something else, our healthcare system is very, very weak. Yes, as Chris has said, we've increased our preparations by opening new facilities, by adding equipment like molecular testing. Initially, we could be having less than 10 laboratories doing proper molecular testing, but now we are having several and more labs coming up to do molecular testing. ICU are in Nairobi and 1 or 2 more other counties, but now almost every other county has ICU. So maybe COVID-19 helped us to prepare, but then we are not really there yet. Again, on the effect now of COVID-19 on our healthcare system, or rather on our medical services, actually the measures would have caused more catastrophe in the healthcare system than the COVID-19 itself. Why? Because, for example, a friend of mine, a medical doctor with a clinic who attends to diabetes patients, to high blood pressure patients, actually was telling me that were it not that he had finished the era of paying school fees for his children, he would close down his practice because the number of people coming for healthcare services dropped significantly during the COVID-19 times. So yes, it affected his income, but also it affected the health of those people. Because as you know, chronic diseases like diabetes and hypertension require regular checkups. So when these people don't come to the hospitals, their risk of dying from those diseases increases. Also, studies have shown that maternal deaths childhood deaths have increased in Africa during the COVID-19 times. Because, for example, health-seeking behavior dropped. Something else, vaccination rates dropped. The vaccination schedules for children, most people were not taking children to hospitals for vaccination. So compounded, that actually affected our health in general. But since we are not a country that is good in generating and keeping data, we might not actually know the exact extent of the effect, but based on communications with individuals in the sector, we can tell that COVID-19 has really affected us, not directly, but in those other measures, positively and also negatively. Thank you.
Well, I mean, and let me just jump in, sorry. I'm feeling Kithinji does a lot of work, especially on the herbal medicine, or what we would call the alternative. And one thing that I discovered, especially talking to people from different communities, also that during this pandemic period, of course, there were restrictions in terms of access to healthcare services within the healthcare facilities that were already marked, because like you could not be admitted or just allowed just for a normal routine check unless you really presented symptoms that were pointing towards, of course, COVID or something like that. So you actually find that people are not going to hospital then because they had nothing, but then because even those facilities were not accessible. Even up to now, they're still restricting. So you are not just free to be able to walk into a facility because you're in a certain position. So I think, because I have no evidence of a study to that effect, but I tend to think that people also resorted now to alternative or intuitive medicine, which really has worked big time. Because when I went to my rural home, I mean, people like, you get either symptoms or anything related to flu, and then they get to concoction of herbs just to be able to take. And so over that period, there has been resort, I would say, to alternative. Probably we've not done research, but I think there's been a lot of consumption now in alternative, because then we don't have access to what I would call the modern, yeah. So something to that effect, which would be interesting to find out to what extent, because all of us heard about what was happening in, which country was this? The ones who produced Madagascar. All of us heard about the Madagascar and the Madagascar thing before even countries thought about vaccines or developing something. So Madagascar had, even through support of government, prepared some concoction, packed it, and was being shipped to several countries. So there could be evidence or possibility, majority of Africans also, because of the crude operating, that also using alternative medicine, which could not be scientific, could not be documented, and has also played a major role in this, in terms of just helping to manage the situation. Thank you.
Yes, I think Chris makes an important point, especially when it comes to confidence in the population. People are taking concussions not really to that it will heal them, but it gives them hope, and it gives them a feeling that they're okay, and life will get to the next day. And I, even as I've listened through the discussion, there are of course many things that have led us to where we are, and as individuals who run organizations, we have felt a different kind of pressure in all this, because you have been working with families, and now other trends that we have seen during this time are issues to do with gender-based violence, children abuse, rates going really high, because people who never used to spend a lot of time together, COVID has made them to spend a lot of time together, you know, and this has led to weird trends. We are seeing a lot of violation of children's rights, gender-based violence in the families, family breakdowns. A lot of this is affecting people on different levels, and I think it's a challenge that we have to organize for, and we have to prepare for post-COVID, because I know post-COVID is coming. But again, that is even worrying, because I read yesterday that Ghana has received the first vaccine. in Africa. Even as the world is talking about vaccine and it's now readily available in the European countries. Today morning, I read that UK is now starting to vaccinate 40 years and above, and now it's now the next lot of people. In Kenya, we haven't received even the first batch of vaccine. And we wonder if it is a huge global conversation, where is Africa in this conversation? Because in 54 countries, only one country has received the vaccine so far. The hope is being built that WHO will support African countries to be able to access, and other poor countries across the world to access. But then even looking at our own schedule, we believe if it comes, the rich will have an opportunity to get vaccinated first over the poor people, because there's a tendency of corruption around our institutions and our systems. So this means if the vaccine is here, the ones who have influence and power will access it first. And where does this leave the vulnerable? And especially with the reality that majority of the older people who are exposed live in the rural areas and might not access information as much. So we will see a situation where even when the vaccine is finally here, people who have access and people who have influence are tending to get it more faster than everyday Kenyan. And I think that also poses a challenge. Now, I think the bigger dilemma is if Europe and the rest of the world are up in arms vaccinating their population and leaving the poor and not ensuring that everybody else access this vaccine, I don't know if they are shooting themselves in the arm, because then they just go back to where everything is, because we should talk about issue of fairness. Everybody should access, and those who cannot afford the high cost of it should be facilitated much faster to access it, because then we might treat ourselves, but the disease keeps coming back from where it has gone in the poor communities. So I think this is a conversation that needs to be brought on a national stage, and campaigns seriously launched that poor countries need to be supported to access this vaccine as much as the wealthy are able to do it. So the issue of cost for me fuels the inequality in access to health, and will expose many families to bigger challenges beyond what we have already experienced.
The whole vaccination issue is a big problem, because we have different companies, we have different vaccinations. Not all of them are effective. At the moment, maybe the Russian Sputnik 5 is the most effective. But then again, Russia has not the capacity to produce enough. At the moment, South of America is trying to buy the Sputnik 5 and trying to vaccinate the population. Sweden stopped the vaccination because they had 25% damage from the vaccination. South Africa stopped because the vaccination is not effective against the virus down there.
Yes.
So vaccination might not be the problem solver. Whereas in India, we have a lot of effective treatment with homeopathy. And I wanted to ask you, Dennis, about the herbal medicines that we have in the rural regions in Africa. How effective is it in supporting the immune system? Because maybe the solution is there.
All right. I was actually to come in regarding herbal medicine, because Chris mentioned it. And I'm an enthusiast of herbal medicine, and I also do research on herbal medicine. My actually master's thesis was about using herbal medicine to treat some bacterial and fungal infections. So about the use of herbal medicines in Africa, actually 60%, more than 60% of Africans rely on herbal medicine. World Health Organization has documented that despite the presence of conventional medicine across Africa, more than 60% of Africans rely on herbal medicine, even in the absence of COVID. Now, coming to the times of COVID, you saw, my fellow Kenyans in the forum, you saw that, for example, Jeff Koinange, a public figure, came out on television to discuss his journey treating COVID-19. And what came out clearly for all people is that he relied heavily on his auntie's herbal concoctions comprising of ginger and lemon to strengthen his immunity and be his recovery intervention. And those of you who use lemon and ginger can bear me witness that the price actually doubled during that time. I'm a regular consumer of those items. And whenever I went to look for them from my regular supplier, sometimes I would not get them. Other times I would get them at very costly prices. So it means Kenyans, and I don't know other parts of Africa, people resorted to herbal remedies for the therapy. By the way, even in the hospitals, I can tell you, for example, in the Kenyatta National Hospital, the place where COVID-19 patients were being quarantined, relatives were taking those concoctions to healthcare practitioners to give them to their relatives. So they come, but no one documents them in the treatment process. And actually that was a concern in China. It's argued that China incorporated what they call alternative medicine or herbal therapy in the treatment of the COVID-19 patients, but then only conventional treatments were documented as having treated them, yet they were using a combination of all of them. So it calls for research. And my professor, one of my professors and myself designed a study actually to test these herbal alternatives that various communities in rural Africa, for example, my mother uses some plant to treat people with respiratory infections. And she did that a lot during the COVID-19 time. So we wanted to test some of those plants that they use to treat these respiratory infections to check whether they can actually treat COVID-19 by first of all starting in the lab, because you cannot directly go to tests in humans. It's not allowed in ethics, in human research ethics. So there are several plants that Africans are using in various rural communities based on their history of using those herbal alternatives to treat other respiratory infections. For example, eucalyptus. Eucalyptus has been documented to have extracts that treat, for example, measles, which is a respiratory infection, and other respiratory infections across the world. But now, no one has taken the initiative to maybe set aside grants for such studies. For example, when we looked for funds to do that research, we couldn't get yet. We had prepared everything, and we were set to test them in the lab and therefore see whether they can be recommended for humans. So it seems that due to those lapses in making them conventional, people are using them directly. So for example, somebody will go to my mother to give them the concoction from that plant, because there are no protocols there other than going to the hospital to be given drugs that they are told they are not sure will heal them and such. About the vaccines, as you've said, by the way, yes, we are very optimistic about vaccines, but our optimism might actually be illusional. Why? Because, for example, for tuberculosis, we have been having the BCG vaccine for several years, for actually more than 50 years. It's amongst the first bacterial vaccines to be discovered. But now people are dying of tuberculosis more than even COVID-19. It's amongst the top killer diseases in Africa. Yet we have the vaccine. All of us are vaccinated against tuberculosis in Africa, but we are still suffering from tuberculosis. It's amongst the endemic diseases in Africa. Something else about now SARS-CoV-2, the vaccines against COVID-19. They are targeting a spike protein, which is actually what scientists would do, because an antibody against that spike protein is what would prevent infection from a new virus. Or whenever a virus comes and you have that antibody, it prevents infection. But then, as you mentioned, in South Africa, a new strain of COVID-19, or the virus that causes COVID-19, has recently emerged. And it appears that the antibodies formed out of the vaccination or out of previous infection are not neutralizing this virus. That means you can be vaccinated, but now the virus against which you are vaccinated can undergo what we call mutation, or a change in that spike protein. So even when you get the infection with the vaccine in your body, the immune system will not be able to resist this infection because the virus changed. You are prepared, your immune system was prepared against this virus that we knew, but now that virus has changed at the place where we had targeted it. So it won't be prevented by what we had prepared. So that tells you that, yes, vaccines can help, but with the assumption that this virus is not going to change at those parts that we've targeted as scientists to prevent infection. So we can, yes, rely on vaccines as one of the options, but we should not take it as the only option because it can frustrate us.
Definitely.
Yeah, let me just make a comment on that, especially the politics around this vaccine. Huh? Dennis, and thank you for highlighting the issue of tuberculosis. Huh? One of the interesting things that we need to pay attention to, especially when we have a conversation about vaccine in Africa, one, there has been a lot of political conversation around really, even the previous one, and we still, like Kenya, I know an instance, and I mean, all of us in the panel, especially I mean, my colleagues, you know the resistance and especially the anti-vaccine campaign that has been there. One, either because of a theory around being laced with certain ingredients, so that then it becomes a way also to address other issues of interest to some political or global positioning. So that one has been there. Like, for example, we've known previously the Catholic Church in the country saying, no, we are not going to do this. A tetanus thing, they have laced it with something, birth control. So it's going to affect especially the targeted population because they were people of reproductive age. So it will have an effect. So probably what they're doing, they're using that, yes, to address one problem, but also to curb something, which is there's a conversation about population dynamics and population control agenda globally. Now, COVID, I tend to think might play on a different scale from the previous vaccines. Reason, if you look at malaria, for example, we have had a transition over a long period of time. We've had different drugs tested, tried different times, and are undergoing a lot of changes from sometimes SP drugs being used, and Kithinji understands this. So we've had, at some point now, we are no longer using this, we need to change this regimen. We are no longer using this, we need to change. The same has been for HIV, for the drugs that have been there. And interestingly, why I say COVID, we have to get industry players putting their heads together to invest for vaccine in Africa, because Africa politically, especially in the global politics, become a continent of interest for both Europe, the larger Asian continent, and even the Americas, the West. Now, because of the extent to which COVID has affected the Americas, Europe, and Asia, and their interest to continue connecting and trading with Africa, and if we leave out Africa without vaccinating them or taking measures to be able to prevent further spread of COVID within the population, then it becomes a risk in terms of other parts of the continent continue to engaging with Africa. And so I tend to think there will be need, even if globally a certain government, because most of donors to Africa have been European countries, Americas and the likes, and they're still struggling with the same, what will happen is that private sector might have to do a lot of investment because of interest they have in Africa. Let's say, for example, the airline industry, the number of flights coming into Africa and tourism. And they're saying, because that population is not vaccinated, so what we do, it's a risky space to take our tourists or to go into. So I am seeing a possibility that even if our governments are not going to take that first initiative, that other industry players will come up. Of course, you've seen Gates and Foundation coming up with a lot of investment in that. So there's a possibility that we are going to get well-wishers investing more in the vaccines to distribute to African governments. The question is this: will the population in Africa be ready to consume that? I think for me, that's really critical. And then the other question is, what conversation is going on in Africa when it comes now to our readiness to receive or be vaccinated? Is there discussion going on to that effect? I think right now the discussion is, because even after all, it's not that fatal. It's not even affecting us. So why should I even go for that? So there will be a lot of work that needs to be done, even if people are going to put in money to be able to bring in vaccine. Now, we understand from a public health perspective, infrastructure alone, even if we invest, might be a problem, because then it alluded to a poor healthcare system in the African continent. Look at the infrastructure. Most of these vaccines actually require some kind of very controlled condition before they are actually administered to the population. Most of African countries have not done fairly well in terms of opening up the country in terms of infrastructure. Probably we'll need another 10 or so years really to expand on how to distribute the logistics, leave alone getting the vaccines delivered into each and every country. The logistics of getting those vaccines from the stores into the population, for me, that's another hell, because we got to appreciate what's happening in the continent. So I tend to think we might not suffer the consequences of the way other vaccines are played, because, for example, TB was not a threat to other population from other parts of the world. Malaria has been, quote unquote, localized within the continent. HIV has also been seen to be localized or domiciled within the continent, bigger than other parts of the world. So it wasn't really a threat to population outside the continent. But because COVID seemed to have that kind of a general spread, meaning, I mean, all of us from any part of the continent is affected, I tend to think there will be a rush, even if the Europes and the Americas and the Asia vaccinate their people, that they need to come and make sure that Africa is vaccinated in good time, so that then the new strains, the restriction that might actually hamper the global economic growth doesn't leave Africa out, because Africa is the next frontier in terms of a global economic shakeup. So for me, it's a thing that we need to think about. It's a big one. I don't know how that's going to happen, but the vaccine will be there. Will the people take it? I don't know.
Answer that. Let me answer that, Chris. If you think of Germany and Austria and the questioning of the population they did, only 25% wish to be vaccinated. The others are indifferent or even oppose. And the older the people are, the more they oppose. So only about, let's say, 20% of the people who are older than 60 will take the vaccination, and only if it is compulsory. Otherwise, they won't. They will rely on the herbal medicine. They will rely on the immune system. So if we think of a global vaccination, there will be some countries and some populations who will be more easy to be vaccinated, maybe Americans, maybe people from the UK, but there will be some countries with people living there who just don't want to get vaccinated. I think the main population of Russia, if it is not compulsory, they won't be vaccinated. And if you think of the doctors who administer the vaccination with Sputnik 5, they tell their clients don't drink alcohol 2 weeks upfront the vaccination and 2 months after. So this will prevent people from getting vaccinated because they like to drink alcohol. And if they do so, they will get damage from the vaccination.
Oh, that's scary. I don't know.
Yeah, I think it's the conversation around the contradiction of the virus for me that gets really interesting, because on one hand you seem like you have the solutions, you have things look easy to handle, but then the consequences and on the other side of what that means and what that causes is what leaves me more baffled about it. I think what I see in Africa today and around the issue of vaccinating is many people have never had a choice. Even as Dennis talked about malaria, tuberculosis, many people are not presented with a choice of you have a vaccination or you do not have. It is actually mainstreamed within our system as it should happen. And we see incidences where vaccination is a routine. So I think if it is available in the African continent, from my view, if it is made available, many people, maybe the older one will have a challenge to go for it, but as they target younger populations, then it will be, the government will come up with ways and mechanisms through which it is mainstreamed as part and parcel of what is needed for you to then live normally, because Dennis mentioned that vaccinations happen in the hospital here. So in the beginning, there will be resistance, there will be difficulties, but I think as it gets mainstreamed in the systems, it will not be even possible for people to know that I've been vaccinated from COVID-19. So for us, the issue at the moment is largely about availability. For those people who might want, will it be available? For those people who do not want, should do so because it is available, but then they are not interested to have it. I think Europe and the other parts of the world have that advantage, that it is available and you will reject it even though it is available. Unfortunately, in Africa, it's the other way around. Even though I might want the vaccination, is it available? That for me is the question.
Yes, and we have a question on the chat. Somebody asked about homeopathy, and yes, I can answer. Homeopathy is very, very, very effective. Our Indian doctors are doing very well, and the Australians with the homeoprophylaxis, who did put some homeopathic remedies together and act with them in some kind of vaccination, they did do very, very well too. They tested that homeoprophylaxis in Brazil, in Romania, in India, and the effectiveness is great and the price is very, very, very low. So Zach has the connection to Australia and to India. If you want, you always can go for that.
Yes, I think to add on that, we had a discussion with Dr. Isaac and together with Dennis and Chris, and the challenge is still the same thing that we are talking about. The homeopathy solutions can be available in Kenya, but the protocols and the procedures through which it has to go before it is available to the people, it's a big debate.
Yes, if you import it for many people on a government base, but if an ordinary person orders it in the pharmacy, then it will be no problem.
But again, as I said, there is a politics around this, which sometimes I never want to run away from them. Globally, you know, the pharma industry is big on some of these. And even right now, the rush really to be able to have which company has the vaccine out and tested and be distributed, because then there's also the business angle to that, the profit that then comes with that. And so even our governments, the way they operate and what I've seen in the past, like I've been in the industry, I mean, not in the industry, rather, the health sector and especially HIV for some time now. There is a lot of bargain and negotiations and sometimes arm twisting that goes even into which products are being procured by government. And you know, for example, almost up to 100% of commodities that are used in HIV response in the country are like from the USG, US government, so PEPFAR, USAID funding and stuff like that. And so they come already even branded from the American people. So who is buying this drug? The Americans are buying it from their people or from their companies and making profit that. So the moment you start a conversation and you want to bring homeopathy or any other alternative medicine into space, who is behind this? Who is going to profit from this? Which government agencies are involved and stuff like that. So there's a lot of politics, even if our government could appreciate and understand that homeopathy or any other alternative would work for the population. Again, we have to navigate the politics around it, which is really, really unfortunate in terms of how even the distribution and availability of these drugs. Because right now, I have had, this is not really from confirmed sources, but of course, there are agencies that are already having meetings, secret meetings with government, just to be able, I mean, of course they pitch. So it's a business, you come and pitch. And therefore, government will put an investment based on value for money. I mean, basic procurement in most of these public spaces. But then who is behind that pitch? Who is pushing that? If, for example, the US government is going to fund Kenyan government, definitely, even if the UK presented the best of the most effective, efficacious kind of, are we going to buy the one from the UK because then, or are we going to get the one from the US because the US government is funding? So again, we got to probably pay attention to the politics and ask ourselves, where is you and me caught up in this conversation, and how then that affect us in the long run? Because that's really, I mean, it's unfortunate. It happened in Africa for a long time, even in terms of just supply of basic commodities like food. We have seen during this time when government is trying to put in measures on social protection, the government has been like cushioning people. Where do we procure? If you want to give vouchers, for example, shopping vouchers to people, from which chain store supermarket are you going to get vouchers from? So there's a lot of politics around even how then do we help our people navigate or emerge from this pandemic. And if the moment politics come at the center, it becomes interesting, because I insist people should take interest. Any decision we make must be a political decision because there are policies involved. But then what effect will that have in the long run, especially for a weak political system like what we experience in the African continent? Thank you.
If you think of that kind of manipulation, then always the best thing is to rely on the resources that are in the country. And this is your herbal medicine.
Yeah.
Maybe to add on that, especially regarding homeopathy and herbal medicine, what I would say is, yes, the World Health Organization has been recognizing herbal medicine as we progress, but now the recognition is actually becoming a problem in the practice of herbal medicine. Why? Because the recognition comes with regulations. For instance, now if you have to regularly administer herbal medicine or prescribe herbal medicine to people, to the public, you have to be registered, you have to pay some subscription fees, you have to meet minimum regulatory requirements, which most of the times are actually about making payments to the government. So the only people who are practicing herbal medicine are the ones who are not claiming to do so, like my mother. She will administer the herbs to you, but not claim to be administering herbal medicine or prescribing herbal medicine. Because the moment she declares that, the regulatory authorities will come looking for her. So it means that only the few people closer or close to her can benefit from a herbal remedy in case she has it. Chris and Zach can bear me witness that when we were discussing with Isaac about bringing homeopathy here, when we did our background check with the Pharmacy and Poisons Board, with the Research Regulatory Authority, we realized that meeting those minimum requirements to establish that distribution chain and to even be able to import would require several millions, which will require funding. And that funding, if you come now back to our healthcare system, you'll notice that even for a local medical intervention like blood transfusion, 90% of blood transfusion services have for a long time been funded by the US government. Yeah. So if you bring something that is not coming to augment what the US government is doing in healthcare, you will be contradicting the political systems, as Chris has said. You will realize that even our healthcare budget in the Ministry of Health, most of it, I think more than 30%, comes from donors. So those donors have political interests. And if you bring something that is not in line with their political interests, you are unlikely to sail through, however effective that intervention is. So even as we think about the effectiveness and the value of these solutions, like the alternative solutions, we have now to think about the politics of it. For example, let's say we've brought homeopathy. What challenges are we likely to face with the regulatory authorities? They will ask for studies to show effectiveness. Are those studies available? They will ask us to do those studies here. Do we have the capacity to do that? Because it will require registering a research organization. The requirement to register that research organization to test the effectiveness of those homeopathy interventions and the herbal medicine interventions. So I think it's time that we get into the politics of this. Because for instance, when we were applying for the funding for the testing of the herbal medicines against COVID-19, we looked into some funding that was advertised by Gates and Melinda Foundation. We were very optimistic about this because it was about interventions against COVID-19, and we thought that these herbal medicines that are being used locally fall into that category of interventions. But at the bottom of the advertisement or the call for applications, it was very clearly stipulated that every interventions apart from herbal or plant or testing of plant extracts. So we cannot rely on the conventional support systems for testing of interventions to test these alternatives or the herbal medicine meant, because like Melinda and Gates Foundation, they are a key funder of these processes, but you find that they are excluding them. So how do we go about it to ensure that we have the resources to provide equally strong evidence as the conventional medicine presents? Because if you come without evidence and you tell somebody homeopathy works, but they know that the level of evidence required to ascertain that something works is, let's say, a clinical trial, a randomized controlled trial, they will ask for that. But you didn't have the resources to conduct a randomized controlled trial for your herbal medicine. This other alternative, the conventional one, it has gone through all the stages of randomized controlled trial. It will be difficult to convince a government or even individuals to take up something that has not gone through randomized controlled trials, yet there is an alternative here that has undergone all the stages of randomized controlled trial. So we have the challenge of especially politics.
Yes, yes. The Indians are very fortunate because they have the Ministry of Ayush, which cares for all that. They have a ministry for the health organization for the public. which does all the traditional things apart from our so-called normal medicine. So I fear we are facing the end of our discussion. I think we need a further discussion on all the politics and the stuff that's going on. You got a lot of comments of people who really liked this discussion and found it very lively. And I'm asking you for your closing words now. So may everybody comment and then we just close the session.
Maybe I can go first. So the thing about COVID, this whole discussion, I think it came with its own blessings, and it has taught us to innovate. It has taught us to have this knowledge of, witty inventions. People have taken on they have taken on digital solutions. They work from home. I think it has come with a lot of, improvement. I know a number of companies which are even looking to rent out their office spaces because people are now working from home. So I would say that COVID, despite the effects it has had from a political, economic, and social sphere, it has also come with its own, new ways of doing things, and which we need to embrace. I think when someone said we want to go back to normal, others are saying, I think there was no normal. This is the new normal. And it's a good way of doing things. So I think it calls on all of us, it behooves all of us to just embrace the new ways of doing things and, just look into the future with eyes of innovation and creativity. That is what will take not only Africa, but the globe to the next level. Thank you.
Thank you.
I think I want to first express a lot of gratitude to Marianne for hosting us, and to the rest of my fellow panelists. We have had a lively and wonderful discussion. I've learned a lot from different perspectives. I know that this is really the beginning, and Marianne will give us an opportunity in future to share more and to engage more. And I really want to say, as young people in Africa, the future is with us. We have the clear minds. We understand what is happening globally because we have an advantage of the technology that is there. We are able to have something like this discussion online, which was something I think our parents and our grandparents never had an opportunity to. So we have a more expanded view of life, and we have access to alternative facts. We can listen to different voices, and we can be able to judge for ourselves what is really the best way to go forward. So I'm really grateful that we are continuing to engage, and we are continuing to bring the voices from wherever we are to our global platform, and people are able to hear, and we're able to share what we know and what we experience. And for me, this is very, very important. So to everyone out there and to everyone watching, I just want to let us know that it's not all hopelessness. There is a lot of hope in this. COVID has presented us, like Dorcas has said, an opportunity to think and think fast. And I think for the first time, many people have come to the fore to solve problems, not just to cry about them, but many people are willing to do something about it, because maybe the people we thought will help us always have been hit hard by these particular problems. So there's no one to turn to apart from ourselves. Thank you.
And I would also like to thank Marie for this opportunity. It's been very interesting to listen to each of you and to also listen for your perspectives. I'm honored for this opportunity, and I hope to, have more of this. What I can say is that COVID has come, and, there's nothing that we can do except to find ways to live with it. And what I can advise maybe all of you is it's here. There's only 3 R's that when I was thinking the other day on ways that we can, you know, move on despite these challenges that we are facing in this time. React, rethink, and recover. Life has to continue. And I hope that, as Dorcas Wamaitha was saying, we will find our new normal, or rather, we will find ways to, you know, continue with our normal lives despite COVID being here. Thank you.
Thank you.
Maybe I can come next. To summarize what I've been talking about, I'll first of all start with the vaccines, and I'll approach this not COVID-19 specific, but human health dimension. Why? Because COVID-19 has come and it's kind of almost going, but human health is a persistent thing. It will be with us all along, as long as we live in this world. So yes, vaccines are effective. For example, they have helped us, especially in Africa, to control measles, but vaccines are not the ultimate solution. And influenza vaccines are a true example that they are not the ultimate solutions. So yes, let's consider vaccines as one of the solutions, but not the only solution. Second thing, now about human health, let us now focus on strengthening our immune systems. How? Eating healthy, physical exercise. Throughout the jobs that I've done for my clients to research on how they can improve their health and how they can educate their public, I've not seen interventions that are as effective as improving the body's immune system and being robust and being ready to tackle any disease than eating well and exercising. So, and that tells you why, for example, Africa was not as such affected by COVID-19, because if you compare with, for example, the US, the non-communicable diseases like diabetes and hypertension, the prevalence in the US is about 50%. In Africa, we are adding to ones there. So what we should work on is now returning that curve. Let's go back to eating healthy so that we don't get to where we have many cases of diabetes and hypertension. And that can be done by eating healthy and exercising. The other thing is the healthcare system. I'm glad that COVID-19 came because we've really improved our healthcare system. Let's hope that our, especially county governments, with the proposed increase in funding of health, will continue empowering the healthcare system to be ready for future pandemics and to actually prepare the bodies, because infectious diseases keep on emerging and re-emerging. We can be vaccinated against COVID-19 now, but another strain of COVID-19 may come and overwhelm that vaccination that we got. But if we prepare our bodies well, any emerging or emerging infectious disease may not be able to overwhelm our bodies. And that now brings me to the final thing, herbal medicine and homeopathy. You will realize that, for example, in herbal medicine, most of the things that are prescribed as medicines in herbal medicine are foods. So they are not risky. There are no safety concerns because you can eat them as your food. For example, I include ginger in almost every diet I have. I include black pepper in almost every diet that I have. Lemon is kind of a daily routine to me. Those are foods, but they are also part of herbal medicine. So basically, I would say, let thy food be thy medicine. But then again, we have now to regularize this so that we can be able to get at par with conventional medicine. We have to research and document. And that calls now for advocacy and research. And the only limitation we have in advocacy and research is lack of funds, because most organizations fund where they will get returns from. For example, pharmaceutical companies will fund your research idea if they know they can develop a vaccine out of it and sell it. But we know that for herbal medicines, it's difficult to patent a herbal product because it's natural. So they are not likely to get interested into that because they won't patent it, and therefore everybody can produce it. So we should think about maybe mobilizing people with this mindset of changing healthcare through herbal medicine. They can come together and contribute in small ways to fund this research and to do advocacy to create awareness about them so that we can have our own pool of funds that we can use to conduct research, document clinical trials so that we can be at par with conventional medicine. Otherwise, we'll be talking about it, but only the people who have taken time to learn about herbal medicine and homeopathy will be using it. The larger public who rely on evidence will only go for the conventional medicine. Sorry for summarizing with so many words. Thank you.
Okay, it's okay. Thank you.
I also want to join the rest of the team just to say, first of all, express my gratitude. Thank you so much. I mean, this has been amazing because really to find time to be able to reflect on what you're going through, especially in times like this, when really there are a lot of pressure from all angles, is not easy. So thank you for that. Secondly, most important point I want to make is this, is that from a public health perspective, we are still like not even in the middle, somewhere in the beginning of this pandemic. So let's not have the public or individual speak as if we are now toward the tail end. We are concluding things, we are wrapping up. We are still in the very nascent stages because we have not really even understood the science of the virus itself. It's still under a lot of evolution. So that's really critical. It's also important that now that we are learning more and trying to come up with interventions or sustainable measures, that we also learn from the mistakes that we've made so far. Probably a time to reflect back. What are the mistakes that we've done? Because it seemed to be saying, this is what has been done, these are the achievements that we've made. But I think learning from the mistakes then takes us to the next level in terms of handling any future pandemics or crises. Because the reality, today, we live in a world of uncertainty. Our politics, we are not sure of the politics tomorrow. It really changed. We've learned from the Americas, we've learned from Europe with the Brexit, we've learned from what is happening in Southeast Asia and many countries. So with that uncertainty, if we can take a moment, reflect back, learn from our mistake, I think we are better prepared for future pandemic. Thank you so much, lovely people. Nice having you.
Yes, thank you all. And I just want to remind everybody that no matter what country you live in, you have old wise women and old wise men there who have a lot of knowledge. Save it as long as you still can. So thank you everybody. Hope to talk soon again.
Thank you.
Bye everybody.